Hey there, and welcome back to the channel. If you've never been here before, I'm Dr. William Lee, and we talk about health, fitness, and all those medical questions you've probably been too embarrassed to ask anyone. But that's what I'm here for, right? I want you to feel comfortable learning about your body without any judgment whatsoever. So stick around, because today we're tackling a topic that affects millions of men around the world. And honestly, it's something that probably happens to you at least a few times a week. We're talking about that annoying little dribble that happens after you pee. You know exactly what I mean. You finish up at the toilet, you think you're done, you zip up, and then boom, a few seconds later, or sometimes even a few minutes later, you feel that uncomfortable wet spot in your underwear. It's frustrating, it's awkward, and it probably makes you wonder why your body is doing this to you. Well, I've got news for you. You're not broken, you're not alone, and there's actually some really fascinating science behind why this happens. Even better, by the end of this video, I'm going to give you some practical evidence-based strategies to significantly reduce this problem or eliminate it altogether. So if you've ever wondered about this, or if you've ever felt self-conscious about it, or if you've just accepted it as one of life's little annoyances, this video is for you. Let's jump into it. So first things first, let's talk about the anatomy, because you can't understand why something is happening without understanding the actual structure involved. The male urinary system is actually pretty incredible when you think about it. Your urethra, which is the tube that carries urine out of your body, actually runs through the prostate gland. Now, the prostate is this walnut-sized gland that sits right below your bladder, and it wraps around the urethra like a donut. The prostate is responsible for producing a significant portion of the seminal fluid that helps transport sperm, but that's not really what we're talking about today. What matters for our discussion is the fact that when you have an enlarged prostate, or when you're dealing with age-related changes in the prostate, it can affect how the urethra functions. But here's the thing that most people don't realize. Even in young guys with perfectly healthy prostates, that post-void dribble still happens. So there's more to this story than just the prostate. You see, your urethra isn't just a simple tube. It's surrounded by muscle, and there's actually a sphincter system that controls the flow of urine. You have an internal sphincter and an external sphincter. The internal one is controlled involuntarily, meaning you don't have to think about it. And the external one is something you can actually control voluntarily. When you're done urinating, your brain sends a signal to close these sphincters, which should stop the flow of urine completely. But what actually happens in most men is that small amount of urine gets trapped in the bulbous part of the urethra, which is called the bulbar urethra. Think of it like when you squeeze a tube of toothpaste. Even after you think you've gotten all the toothpaste out, there's always a little bit left inside the tube, and if you apply pressure, it comes out. That's essentially what's happening with your urethra. After you stop urinating, there's still a small amount of urine sitting in that bulbous section of the urethra. And then when you move around, when you walk, when you squeeze your pelvic floor muscles without realizing it, or even when you just shift your weight, that residual urine gets pushed out. And this is completely normal, and it's one of the most common urological complaints that men report. I see patients literally every single week who come in concerned about this exact issue. And you know what I always tell them? In most cases, this is not a sign that anything is wrong with you. It's just how the male body works sometimes. The amount is usually pretty small, less than a milliliter or two, but it's enough to create that uncomfortable wet sensation that drives people crazy. Now, as men get older, this problem can actually become more pronounced. As we age, our prostates naturally enlarge. This is something called benign prostatic hyperplasia, or BPH, and it happens to basically every man eventually if he lives long enough. The prostate enlarges not because of cancer, but because of hormonal changes and the natural aging process. When the prostate enlarges, it can put pressure on the urethra, and this means the urethra doesn't empty as completely as it did when you were younger, so you might end up with more residual urine in that bulbous section, which means more of that annoying dribble. There are also other conditions that can contribute to this: urinary tract infections, chronic prostatitis, which is inflammation of the prostate, diabetes, and neurological conditions can all affect how completely your bladder and urethra empty. But here's the important part that I really want you to understand. In the vast majority of cases, post-void dribbling is not dangerous. It's not a sign of cancer. It's not something that's going to lead to serious complications. It's annoying, sure. It can be embarrassing if you're dating someone new or if you're in a situation where you're concerned about how your underwear looks. But medically speaking, it's not harmful. That said, if it's bothering you, and it bothers a lot of men, then there are definitely things you can do about it. So let's talk about the solutions. The first and most straightforward strategy is what I call the milk back technique. This is probably the simplest thing you can try, and it works for a lot of guys. Here's how it works. After you finish urinating and you're preparing to zip up, you're going to use your fingers to apply gentle pressure to the area between your scrotum and your anus. That area is called the perineum. You're basically going to gently push upward and backward in a massaging motion. This helps to push the residual urine out of the urethra before it gets trapped there. Some guys find it helpful to do this while they're still at the toilet. Other guys do it after they've already stepped away. Either way works. The reason it's called the milk back technique is because you're essentially milking the urethra, similar to how you'd milk a cow. You're using gentle pressure to empty out that bulbous urethra before the sphincters close completely. Now, I want to be clear about something. You don't want to be aggressive or rough with this. Gentle pressure is key. You're not trying to hurt yourself or cause any damage. You're just using a little bit of pressure to help evacuate that last little bit of urine. Most guys find this technique takes about 5 to 10 seconds, and it can dramatically reduce or even eliminate the post-void dribble. The great part about this technique is that it costs nothing. It doesn't require any equipment, and you can do it anywhere. So whether you're at home, at work, or anywhere else, you can incorporate this into your routine. I'd recommend giving it a try for about a week and see if it makes a difference for you. The second strategy is what I call the double void technique. This is where you urinate, wait a few seconds, and then try to urinate again. The idea is that the first void empties most of your bladder, and the second void helps to clear out any residual urine in the urethra. Some guys combine this with the milk back technique for even better results. You'll do your initial urination, use the milk back technique to clear the urethra, wait a few seconds, and then attempt to void again. This second void usually produces just a little bit more urine, but it helps ensure that the urethra is more completely emptied. This is another technique that's free, easy to do, and there's no risk involved. Now, here's something that might surprise you. The position you're in when you urinate can actually affect how much post-void dribble you experience. Most men urinate standing up, which is totally fine and convenient, but some men find that sitting down to urinate allows for more complete emptying of the bladder and urethra. This is because when you're sitting down, you're in a more relaxed position, and gravity helps to empty the bladder more completely. Now, I'm not suggesting that every guy needs to sit down to pee. That's a personal preference, and I understand that standing is more convenient for most men. But if you're really struggling with post-void dribble, and you're willing to try different things, sitting down occasionally might help. Some men also find that leaning forward slightly when standing helps with more complete emptying. Another important factor that people often overlook is hydration and general health. If you're dehydrated, your urine becomes more concentrated, and you might not empty your bladder as completely. You might think that drinking less water would reduce the amount of urine and therefore reduce the dribble. But actually the opposite is true. When you're properly hydrated, you're urinating more regularly and your body is functioning more efficiently. Men who drink adequate water throughout the day often report fewer issues with post-void dribble. Additionally, maintaining good overall fitness and health supports better urological function. Obesity and sedentary lifestyles have been associated with worse urological symptoms in men. So regular exercise, maintaining a healthy weight, and staying hydrated are all factors that can contribute to better urological health overall. Now, let's talk about some of the medical interventions that are available if these behavioral techniques aren't enough. If you're dealing with post-void dribble and you suspect it might be related to an enlarged prostate or BPH, there are medications that can help. The most common class of medications are called alpha blockers. These medications, such as tamsulosin or doxazosin, work by relaxing the smooth muscle in the prostate and the neck of the bladder. This allows for more complete emptying and can reduce post-void dribble significantly. These medications take several weeks to reach full effectiveness, but many men see improvements in their urological symptoms within a few weeks of starting them. There are potential side effects like dizziness, fatigue, and decreased libido, so you'd want to discuss these with your doctor to see if they're right for you. There's also another class of medications called 5-alpha reductase inhibitors. These medications work by actually reducing the size of the prostate over time. They take longer to work than alpha blockers, sometimes taking several months, but they can provide significant long-term improvement in urological symptoms. Again, these are prescription medications, and you'd need to have a conversation with your doctor about whether they're appropriate for you. In some cases, if men have very significant symptoms related to BPH or prostate problems, there are surgical options. These range from minimally invasive procedures like transurethral resection of the prostate or TURP to more involved surgeries. But I want to be really clear about this. If your only symptom is a little post-void dribble that happens occasionally, surgery is almost never necessary. Surgery is reserved for cases where men have significant urinary symptoms that are severely affecting their quality of life. We're talking about men who can't hold their urine, who have to wake up multiple times at night to urinate, who have weak urinary streams, that kind of thing. A little dribble here and there doesn't usually warrant surgical intervention. One more thing I want to mention is the importance of pelvic floor exercises, also known as Kegel exercises. These exercises strengthen the muscles that control urinary flow, and they can be surprisingly effective at reducing post-void dribble. Here's how to do them correctly. You want to identify your pelvic floor muscles. The way to do this is to stop the flow of urine midstream. The muscles you use to do that are your pelvic floor muscles. Once you've identified them, you can perform Kegel exercises by contracting these muscles and holding the contraction for 3 seconds, then relaxing for 3 seconds. You can do sets of 10 contractions 3 times a day. It might take a few weeks for you to notice improvements, but many men report significant reduction in post-void dribble after doing Kegel exercises consistently for 6 to 8 weeks. The nice thing about Kegel exercises is that you can do them anywhere, anytime. You can do them while you're sitting at your desk at work, while you're watching television, while you're driving. Nobody has to know you're doing them, and there's no cost whatsoever. I also want to touch on something that a lot of men experience, which is anxiety around this issue. Some guys become so worried about post-void dribble that the anxiety itself makes the problem worse. They start catastrophizing about it, wondering if people can tell, if they smell, if it's going to be noticeable. This anxiety can actually tense up your pelvic floor muscles, which ironically can make post-void dribble worse. So part of the solution is actually psychological. You need to give yourself permission to not worry about this so much. It happens to most men. It's normal, it's not dangerous, and it's definitely not something to feel ashamed about. The more you can relax about it, the more you implement some of these techniques, the better you'll feel about the whole situation. Let me also address some common misconceptions I hear from patients. Some guys think that post-void dribble means they have a weak bladder or that something is seriously wrong with them. That's just not true. Post-void dribble happens to healthy men in their 20s, 30s, and 40s. It's not exclusive to older men or men with health problems. Some guys think that if they just hold their penis a certain way or squeeze really hard, that will prevent the dribble. While external pressure can help in the short term, it's not a long-term solution and can actually be uncomfortable. Other guys think they should avoid urinating, which is definitely not a good strategy. Holding your urine too long can actually lead to urinary tract infections and other problems. What I really want to emphasize is that the techniques I've shared with you today, the milk back method, the double void technique, the positional changes, the hydration, the Kegel exercises. These are all evidence-based approaches that have helped countless men reduce or eliminate post-void dribble. And the beautiful thing about all of them is that they're completely natural, they don't cost any money, and there are no side effects. So there's really no downside to trying them. Give them a shot for a couple of weeks and see what works for you. Different techniques work for different guys. Some men find that the milk back technique alone is enough. Other guys find that a combination of techniques works best for them. Now, if you've tried these approaches and you're still experiencing significant post-void dribble, or if you're also experiencing other urological symptoms like difficulty urinating, frequent urination, or pain during urination, then you should definitely schedule an appointment with a urologist. These could be signs of other conditions that need medical evaluation and treatment. But for the majority of men who are just dealing with a little harmless dribble, these self-help techniques are exactly what you need. I also want to talk about the emotional and social aspect of this issue because I know it matters to guys. I've had men come into my office who feel embarrassed about this, who worry about dating, who are concerned about what people think. And I always tell them the same thing. This is a completely normal bodily function. Every adult man knows this happens sometimes. If you're in a relationship with someone who judges you for normal, healthy bodily functions, that says more about them than it does about you. And if you're dating and worried about someone noticing, let me tell you, the amount of urine we're talking about here is so small that it would be virtually impossible for anyone to detect unless they were specifically looking for it, which, let's be honest, they're not. So give yourself some grace and some compassion about this. Here's something else that's worth mentioning. The awareness and normalization of discussions around men's health has improved dramatically in recent years. 10 years ago, a lot of men wouldn't dream of talking to anyone about post-void dribble. Now we're making videos about it on YouTube, we're talking about it openly, and we're helping men understand that these are normal bodily functions that don't define them. So if watching this video and learning that you're not alone helps you feel better about yourself and your body, then I'm glad I made it. Let me also quickly touch on the difference between post-void dribble and other urological conditions. Urinary incontinence is when you leak urine involuntarily throughout the day or night without any control. That's different from post-void dribble, which is a few drops that come out after you've deliberately finished urinating. Urinary incontinence can be a sign of more significant issues and definitely warrants a conversation with your doctor. But post-void dribble, in most cases, is just a quirk of male anatomy and physiology. Similarly, if you're experiencing pain during urination, burning sensations, blood in the urine, or signs of infection, those are different issues that need medical attention. But again, simple post-void dribble is generally not something to worry about medically. So let me summarize the key takeaways from everything we've discussed today. First, post-void dribble is a normal and common experience for men. It's caused by residual urine trapped in the urethra after you finish urinating. It's not dangerous, and it's not a sign that something is seriously wrong with you. Second, there are multiple evidence-based techniques you can try to reduce or eliminate post-void dribble. These include the milk-back technique, the double void method, positional changes, staying hydrated, and pelvic floor exercises. Third, if these self-help methods aren't sufficient, there are medical interventions available, from medications to more intensive treatments, but these are usually reserved for men with more significant urological symptoms. Fourth, anxiety and emotional distress about post-void dribble can actually make the problem worse. So part of the solution is giving yourself permission to not stress out about something that's completely normal and harmless. And finally, if you're experiencing post-void dribble along with other concerning urological symptoms, or if the problem is really interfering with your quality of life despite trying these techniques, you should definitely reach out to a urologist for professional evaluation and personalized treatment recommendations. They can assess your individual situation and determine if there are any underlying issues that need to be addressed. I want to end by saying that as a doctor, I see so many men who are struggling with issues they feel too embarrassed to talk about. And what I've learned over years of practice is that most of these issues are incredibly common, incredibly treatable, and absolutely nothing to feel ashamed about. Your body is doing exactly what millions of other male bodies do every day. You're not broken, you're not alone, and you're definitely not going to be judged by me or by any competent healthcare professional for asking questions about your health. If this video was helpful to you, I'd really appreciate it if you could hit that like button and subscribe to the channel. I make videos regularly about health, fitness, and medical topics that affect your everyday life. And if you've got questions or topics you'd like me to cover in future videos, please leave a comment down below. I read all the comments, and I really do take your suggestions seriously when I'm planning future content. Thanks so much for watching, and I'll see you in the next one. Take care of yourselves, and remember, asking questions about your health is never something to be embarrassed about. That's what I'm here for.